MoonDust eLearning presents the Moon Twins as they teach you about the skeletal anatomy of the human leg, knee, and foot. The leg, knee, and foot are part of the appendicular system. You will learn about the body regions and bones of the leg, knee, and foot, explanation of joints, and the interosseous membrane of the lower leg. Be sure to visit the MoonDust eLearning store on the Teachers Pay Teachers website using the URL shown here to download worksheets and assessments as well as many more resources. Let's get started. The body is divided into body regions. The body regions of the leg, knee, and foot called the femoral for the upper leg or thigh, patellar for the front of the knee, popliteal is for the back of the knee, sural is the lower back of the leg. The foot is known as the pedal. The toes are known as digits. And the talocrural is the ankle. We will eventually learn all the body regions of the human body. For now, let's concentrate on the leg, knee, and foot. The bones of the human body act as a framework for the muscles to move the bones. For example, there are 30 bones that form the framework of each lower limb. These bones form attachments for muscle to help do all the movement expected of the leg, knee, and foot. The three main bones of the lower limb or the leg are the femur, tibia, and fibula. The only bone of the thigh bone is the femur bone. The legs carry the weight of the erect body and are subjected to tremendous forces when someone jumps or runs. The femur articulates proximally with the hip and distally with the tibia and fibula. Let's take a closer look at the femoral region, or otherwise known as the upper leg. Here is the head of the femur, neck of the femur, lesser trochanter, intercondylar fossa, medial condyle, greater trochanter, intertrochanteric crest, femur, and lateral condyle. Let's take a more detailed look at the knee. Here is the patella, lateral collateral ligament, medial collateral ligament, anterior cruciate ligament, articular cartilage, posterior cruciate ligament, meniscus. The anterior cruciate ligament is an anterior central knee ligament that fixes the tibia and femur in place, preventing them from moving. The patella is the largest irregular-shaped bone in the human body. It protects the anterior portion of the knee joint. The meniscus are the C-shaped pads of cartilage that act like shock absorbers of the knee. The posterior cruciate ligament is located within the knee joint. It keeps the tibia from moving backward from the thigh bone. The lateral collateral ligament runs along the outer side of the knee from the top part of the fibula to the outside part of the lower femur to stabilize the knee joint. The medial collateral ligament runs along the inside of the knee from the upper tibia to the bottom inside part of the lower femur to help stabilize the knee joint. The complex, living tissue that lines the bottom portion of the femur joint surface is called the articular cartilage. It provides for a low friction surface, helps with bearing during movement of the leg. Now it's time to look at the lower leg. The main bones of the lower leg are tibia and fibula. The fibula is a stick-like bone with slightly expanded ends and is located laterally to the tibia. The tibia and fibula articulate with the femur proximally, and the ankle bones distally. The joints between the tibia and fibula cannot move and are called the tibiofibular joints. The tibia and fibula are held together by the interosseous membrane. It prevents the two bones from pulling apart and holds them firmly in place. Now let's learn about the bones of the foot. The parts of the foot include the tarsals, metatarsals, and phalanges. There are 7 bones in the foot that form the tarsus. 2 of these bones are the talus and the calcaneus. These bones form a bony framework around the proximal ankle and heel. The talus is the most superior of the tarsal bones and transfers the weight of the body to the foot. The calcaneus forms the heel of the foot. The calcaneus carries the talus on its superior surface. The calcaneus acts as a point of attachment for the Achilles tendon of the calf muscles. Other tarsal bones include the cuboid, navicular, and medial, intermediate, and lateral cuneiforms. The metatarsal bones form the middle part of the foot's arch and are important for supporting the weight of the body. They act like shock absorbers. There are 5 metatarsal bones in each foot indicated by Roman numerals, with the medial, that is closest to the midline of the body, to lateral, that is farthest from the midline of the body. The phalanges of the foot are the toe bones. 4 of the phalanges have a proximal, middle, and distal phalange except for the toe bone, which only has 2 phalanges. The phalanges are important for providing dexterity. The ankle, or the talocrural region, is the region where the foot and the leg meet. As mentioned previously, the lateral and medial malleolus help form the ankle.